any examples? Evidence-based practice is very important. We also know that function is important. People go home and they need to function. How do can you give me some examples of times where you've been able to facilitate with your team members or yourself, with your patient, on tying a functional activity that just makes it right? You're doing the right thing, and then your productivity is there. Can you give me some examples of situations with patients or that you've seen with other therapists? Maybe you've coached someone along.
So at our facility, we have a few programs that we've incorporated to allow productivity to stay high and at the same time allow the function. We have a program called Walk to Dine where we're asking all of our patients to walk to the meal rooms each and every meal, and we can use this time as a productive time because we are assessing their gait, they are walking to and from, we're educating them. We also use what we call an ADL list. Each morning, the OT staff have created this list the day before that they're going to work with the patients on these ADL tasks. So their nursing staff is aware, they don't work on that, they can be effective, more efficient in working with other patients. So it kind of creates this nice flow within the building.
We're really similar with, we have a rehab dining program, and it allows therapists not only to engage with the patients, but also staff to really train the staff on what the expectations are and what the patients can do, because it never fails where someone can feed themselves and you look over and they're being fed. And so just to really educate all parties involved for their benefit and to keep our patients as independent as possible, because we know once they start losing function, cognition goes down, ambulation goes down. So our goal is to keep patient outcomes the best and just keep providing the best optimal care.
So let me throw a scenario out to you. You have someone in your department that comes back and says, I wasn't able to see this patient. They needed to go to the bathroom, so they weren't ready for therapy. What's you're smiling. So what's your response to that?
That's an excellent opportunity to actually get the treatment
right.
time. I mean, that's cross-discipline really with OT and PT as well, because you're dealing with balance, you're dealing with core strength, you're dealing with bilateral extremity strength, lower extremity strength. So it's an opportunity really to treat and deal with, as you would say, the need itself. Plus you can pull CNAs in and look at best care techniques at that point. So it's definitely an opportunity, and within that then you can actually oftentimes potentially see the patient longer, and then if you have that same difficulty the next day, it's less of a challenge. So
it's a great time to provide education for nursing on cueing and sequencing techniques that you found work best for the patient. And then also our speech therapist is wonderful about working on safety and sequencing in those times. They may not be hands-on physically assisting the patient because that's not their role, but they can be there with a CNA and do that education that they need.